9 years old female patient came to you with complaints of respiratory distress and tachypnea. What will you ask in history? About respiratory distress and tachypnea: onset, duration, severity, progression, specific time of occurrence during day or night, associated symptoms like fever, cough, edema, palpitation, jaundice, renal problems, anemia, any family history or past medical history. What will you examine? General physical examination: vitals, weight, height, anemia, jaundice, clubbing, BCG scar, lymph enlargement, cyanosis, petechiae, bruises, etc. Respiratory examination: abdominal examination, CVS, CNS examination. Your patient has no other symptoms like fever, cough, palpitation, edema, cyanosis, clubbing, lymph node enlargement. She is not wasted or emaciated. There is no past medical or surgical history. She has tachypnea SOB during the daytime with no symptoms at night. Chest is clear with equal bilateral air entry. Respiratory, CVS, CNS, and general physical examination are unremarkable. What are the further questions you want to ask to rule out history? Socioeconomic history, home relations, parental bonding, income and its source, stress, anxiety, previous mishaps. Her father has died, and her mother is a working woman with a low income, unable to give proper attention to the patient. What's your diagnosis? Conversion disorder / somatoform disorder. Diagnostic criteria for somatic symptom disorder. A. One somatic symptom that is distressing. B. At least one of the following somatic symptoms. 1. Disproportionate and persistent thoughts about the seriousness of one's symptoms. 2. Persistent high level of anxiety about symptoms. 3. Excessive time devoted to these symptoms. C. Persistent, typically 6 months. Specify if with predominant pain, previously known as pain disorder in DSM-4. Somatic symptoms predominantly involve pain. Persistent, severe symptoms, marked impairment, and long duration, 6 months. DSM-5 diagnostic criteria for conversion disorder or functional neurological disorder. A. One symptom of altered voluntary motor or sensory function. B. Clinical findings are not correlated with a recognized neurologic or medical condition. C. The symptom is not better explained by another medical or mental disorder. D. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of life. Specify symptom type: weakness or paralysis, abnormal movements, swallowing symptoms, speech symptoms, attacks, seizures, anesthesia, sensory loss, special sensory symptoms, e.g., visual, olfactory, hearing, or mixed symptoms. Principles of treatment include attempts to resolve any apparent emotional difficulties, avoidance of unnecessary physical investigation, removal of secondary gain, and help in returning to normal life. Cognitive behavioral therapy, CBT, e.g., relaxation training, biofeedback, hypnosis. Modifying parental response patterns. Paper bag breathing: hold a small paper bag, the kind used for lunches, over the mouth and nose. Ask the patient to take 6 to 12 normal breaths, then remove the bag from the nose and mouth. Repeat as needed. A combination of pharmacotherapy, physical therapy, and psychological interventions in multi-component management programs has been shown to be effective. Medications: drugs for depression and anxiety, SSRIs.